Hello, I'm Ailish Moriarty, a 2019 Nuffield Scholar, and I'm here today to present my research topic, Assess the Role of Milk Screening for Disease within the Development of an Effective Heart Health System. Ireland's approach to proactive heart health management is based on the World Health Organization One Health strategy. One Health is recognised as key to tackling antimicrobial resistance. AMR is estimated to be responsible for 33,000 deaths per year in the EU alone and 700,000 deaths globally. INAP has been established, which focuses on protecting antibiotics for the future. New EU regulation comes into force in January 2022, and this will offer a springboard for further progress on reducing AMR. My study builds on this solid regulatory foundation, and 4 principles of proactive heart health management apply. Prevention is better than cure, combat disease and AMR, continually assess risk, and ultimately preserve the integrity of our food products. One method to determine heart health is milk screening for disease. At the heart of milk screening is good data, which supports evidence-based decision-making. The committed farmer and the capable vet can share, interpret, decide, and adopt recommendations based on the milk screening results. At its simplest, milk samples are taken 4 times a year and analysed through an ELISA or PCR machine for detection of host antibodies. Various endemic diseases like BVD, Salmonella or IBR can be tested. Milk screening can be conducted on bulk or individual milk samples, as in the case of Johne's disease, but it is important to consider test characteristics and limitations. But milk screening can have many overarching benefits. It can benchmark and provide an initial impression of the heart. It can identify trends and triggers. There is value in continuing to protect the negative and naive hearts, but most importantly, it can alert the farmer and vet to any potential heart health issues which are occurring on farm. One of my first case studies was to examine what technical supports are available to assist farmers, as to be honest, farmers aren't data analysts. One cloud-based solution is myhealthyhair.com, designed by Pete Orpin and Dick Sibley. This measures and analyses disease-specific risk using algorithms to create a traffic-like system of categorization. It ranks individual risks to enable prioritization of control. Biosecurity, biocontainment, and resilience must be factored when analysing the results, and clinical assessment of the results is completed by the vet with 3 to 4 key action points then agreed with the farmer. Building on the efficient capture and use of data, my research recognises that all stakeholders within the dairy industry need to adopt roles and responsibilities to collaborate, lead, drive and empower to deliver outcomes which best serve the industry and the consumer. Throughout my travels, I witnessed various approaches on how best to achieve this. In the Netherlands, I was able to see firsthand farmer-vet collaboration. Traditionally, the relationship that existed was one of reactive veterinary care, with the vet's income predominantly coming from the treatment of sick animals. Utrecht University, in collaboration with Courage, have set out to change this, and the innovative project Healthy Partners was developed. The vet now had a vested interest, as the vet's income depended on the farm achieving outlined health targets. Feedback from Martin Noel, a farmer who is a major advocate of the initiative, was that the vet was now a key partner in decision-making, there was shared responsibility, and the vet was a valued member of the team. Red Tractor have adopted a lead approach. Red Tractor is one of the UK's largest food standard agencies, which covers animal welfare, food safety, traceability, and environmental protection. In October 2019, the Red Tractor standard was revised, and it is now mandatory that a livestock health plan is written in conjunction with the farmer and the vet to actively demonstrate health and welfare on the farm. An accredited British Cattle Veterinary Association vet declaration is required, and the farmer must participate in schemes such as BVD Free England. Revision to this standard has had a massive impact in participation levels in the UK's National Illness Management Plan, and by the end of 2020, 95% of national milk suppliers will be on board. Friesland Campino have adopted a drive approach. Friesland Campino is a farmer-owned cooperative based in the Netherlands, Belgium and Germany. One of Friesland Campino's unique selling points is it's always focused on and prioritised animal health and welfare. This strategy has added value to the brand, particularly in relation to its export market. It is driven forward with zero tolerance. If animal health checks, which are compulsory, do not meet the required standard, the milk will not be collected from the farm. The farmers must step up and demonstrate disease-free status in their herds. Data is currently stored in silos, and development of a central data point is necessary to oversee the various health checks. This is currently a key priority for Friesland Campino. And finally, the Empower approach. TISA, a Danish organic cooperative, through working in collaboration with their farmers, have successfully eradicated Jones disease. A farm-specific control program and schedule was designed with a TISA representative and with TISA paying for the cost of the individual milk screening. Farmers met regularly in groups to troubleshoot and discuss disease progress. Once Jones was eradicated, the farmer was incentivized and paid a bonus for their milk. Farmer empowerment has enabled farmers to make significant progress on eradication of Salmonella Dublin. Erling Bond, a Danish farmer, emphasised that a key factor which aided disease control was availability and access to a central cattle database. The Danish cattle database was very impressive, with Erling even able to request extra milk screening tests himself if required. The collaborate, lead, drive and empower approach have helped me formulate my key recommendations. We face many regulatory challenges and we need to prepare for this and accelerate progress on effective herd health management. All stakeholders, the committed farmer, the dairy industry and the engaged vets need to be at the table and co-design proactive herd health management programs. Where the early adopters in the veterinary community have led the way in terms of a collaborative knowledge share approach, the wider community of vets must come on board. The strength and importance of the farmer-vet relationship just cannot be underestimated, and the vet can become a key influencer of scheme awareness and uptake. A clear financial business model must be identified where all stakeholders are vested, and co-funding support could be provided by TASA, the Targeted Advisory Service on Animal Health. Animal Health Ireland's veterinary risk assessment and management plan should be launched and become mandatory on all farms. This template has been successfully used for Ireland's BVD eradication and Jones control programme. A herd-specific schedule and action plan should be formulated, and this would determine what young stock or milk screen tests are required. All stakeholders within the dairy industry need to lead and empower farmers and vets to achieve better herd health outcomes. Milk purchasers could support risk assessments like an initiative Kerry Agribusiness is currently involved in. We need better decision support. Development of effective, simple, user-friendly formats can guarantee follow-through. We must fully utilise ICBF, the only farmer-owned national herd database in the world. All service providers within the industry must consistently promote this service and encourage more farmers to access the on-farm support tools which are available. The Irish dairy industry should embrace new technologies like milk infrared spectrometry and precision technology with confidence. To conclude, at the beginning of my scholarship, my emphasis was just on milk screening for disease, but my realisation now is this is only one aspect of holistic herd health management. Through proactive herd health management and the efficient capture and use of data, the engaged vet, the committed farmer and the collaborative industry can lead, drive and empower to protect herd health and the sustainability and profitability of Irish dairy farms and industry. At all times, we must honour our commitment to deliver safe, wholesome food to the consumer. I would like to thank Paddy, my husband, and my children, Patrick and Aoife. I would like to thank my work colleagues at Kerry Agribusiness who were fantastic at holding the fort while I was away in my travels. I was absolutely overwhelmed by the welcome I received in my independent travel, and I thank you all. And a special thank you to the people here in Ireland who took the time to discuss my study topic with me. I would like to thank Nuffield Ireland, especially John Tyrrell, Jeff Dooley, Cam Brosnan and my mentor Fionnuala McCoy. And lastly, I would like to thank the Nuffield farming sponsors, as without them the scholarship would just not be possible. Thank you.